Hey everyone, this is Troy with the Advanced Spine, Joint, and Wellness Center once again. Hey, today we're going to talk a little bit about what's called McKenzie physical therapy. This is a type of physical therapy we really do a lot of here at the Advanced Spine, Joint, and Wellness Center. If you haven't seen us or heard us before, you can find us at ohiopain.com. We are Ohio's largest chiropractic integrative office with everything from chiropractor to neurosurgeon. But today what we're going to do is we're going to talk about McKenzie therapy. We do a lot of this in our office. Now, the key here is I get this all the time in the community. Like last night I was even at an event over at school. I get this all the time. Someone comes up and goes, "Hey Troy, what's the best exercise for this problem?" And the answer is almost always, I don't know, because it depends. Now, the reason I say that is you'll see on Instagram or YouTube or Google the 3 best exercises or stretches for sciatica, the 3 best stretches for this, the 3 best stretches for this. And the long and the short with those things, everybody's body is different, and that's what McKenzie therapy is all about. Now, if you've tried McKenzie therapy and they didn't individualize it to you, or you tried physical therapy or maybe some chiropractics with this physiotherapy in their office and it failed, well, that's likely because it wasn't individualized to you, meaning that McKenzie therapy works on what's called a red light, green light principle, meaning that when we really look at McKenzie exercises, not all exercises apply to each patient. So we see a ton of patients here that fail physical therapy or chiropractics in isolation in other offices because the program wasn't individualized to their problem, meaning that McKenzie therapy, here's a normal joint. Things should be mobile, freely moving. There's a disc in the middle here. It keeps this space open. That space also keeps the tunnel open for the nerves here, and everything should be freely mobile. Now, what oftentimes happens is when we damage a joint in the back, say it becomes degenerative or we get a disc bulge or a disc herniation, something like this, the joint oftentimes fixates and we get pressure on a nerve. Now, when that happens, that's where oftentimes physical therapy fails because a lot of therapists will start with strengthening. A lot of them will even try some physical therapy or McKenzie therapy without it being individualized. And what happens is they just start moving things, and we might be moving in directions for what we call red lights, meaning don't go that way. So McKenzie therapy should truly work on what's called a red light, green light principle and stretching only. We only stretch these issues early on. We do not strengthen. That oftentimes is a huge mistake. So what we want to do is we're going to interrogate the spine to find ways that we can move the joint comfortably away from nerve pressure. That's called a green light. Then there are directions that we might move these joints and then it causes increased symptoms. That's called a red light. And that's where McKenzie therapy becomes unique. Then we have to select the proper exercises in the proper directions of green lights and then slowly, the key here is slowly work in the directions of green lights. We can't keep pushing in the directions of red lights. Just saw a patient like this yesterday who had failed physical therapy, and she kept telling the therapist, every time we go this way, it hurts. It makes my hamstrings tight and I feel a burning pain, but they just kept going more and more and more and more and more. And that was actually moving in the direction of one of her red lights, which meaning that put pressure on a nerve. So again, what we're going to do is we're going to start making small repetitive motions in the directions of green lights, avoiding red lights. And what happens is as we do this here, we oftentimes start our patients on home-based stretching every 2 to 4 hours based on their green lights. And it's like slowly beginning to loosen up a rusty bolt on a car. Slowly the joint will start to create motion again, and we're going to reduce nerve pressure. So that's what's so unique about McKenzie therapy. And that's what's so unique about us is typically with these types of issues in McKenzie therapy, we only want to work on pain relief first. We're going to be using multiple modalities, oftentimes with a lot of patients, to help reduce pain first. Then we can strengthen once pain is decreased or motion is returned back to normal. But if there's muscle tightness, muscle tension, pain, inflammation in muscles, and joint restriction, we should not be strengthening, and we should be identifying red lights and green lights for these spine issues. So hope that helps. If you have questions about McKenzie, just hit the button below. Go ahead and reply and ask any questions that you may have. If you feel like this is something that may benefit you, feel free to go to our website. It's very easy. You can go to ohiopain.com and you can contact us directly for an initial consultation, 330-721-6504, and we will talk to you next time.